in many ways, I feel like my work has already been done here, because I often find myself making this presentation to individuals who have not fully made the connection between arts and health. That's clearly not the case here today. So I'm excited to explain to you from a different perspective what we've been doing at the Department of Health in partnership with the Rhode Island State Council on the Arts to develop a state plan around the integration of art and health in Rhode Island. There is, of course, a national organization that's working to promote this field as well, but we are really at the cutting edge of developing a field here in Rhode Island because of two reasons. There has never been a partnership developed between a state council on the arts and a Department of Health in this way. So we are in many ways forging the ground and teaching other states how to build that relationship. Secondly, there is no other state plan for the integration of art and health that exists. This is the first of its kind. It is intentionally high level, so I've left copies of it out in the lobby, and as you look through it, you'll realize that we have much work to do as we try to figure out how we're going to drive this field forward. We knew from the onset that every time we turned a corner, we'd be meeting more individuals like all of you who would have input and engagement in this project, and that would help to forge the direction that it will take as it grows. The long-term goal is to really develop somehow, a center for arts and health in the state, and we're not sure what that looks like or how we'll get there, but that's the objective of this plan. So I usually like to start the presentation with this slide because it gets at sort of the background for the reasoning behind the project. It really just expresses that the U.S. spends a lot more money in medical in healthcare than other countries do, by far a lot more, and yet our life expectancy is far worse. This is just another way of showing the difference between the expenditures in healthcare and those on social services. As you can see, the United States is far ahead in terms of the money we spend on healthcare and really lagging. So our objective is really in public health to begin to try to flip that and become more aligned with other countries and improve the life expectancy of the people in our country. Another way of sort of showing that is to just express that public health has studied this hard and long, and what we've learned is that clinical care, that interaction between us and our healthcare teams really accounts for about 10% of our health and well-being over the span of our lives, and the rest of it is made up of those things that we call social, economic, and environmental determinants of health. And this is the thing that is the backbone of this project and the backbone of where public health agencies are directing their efforts going forward. It's been out there for quite some time, but what we've realized is that we no longer can be the only individuals at the table when it comes to driving improvements in public health. We need folks who are engaged in work around those environmental and social determinants. So we have to be sitting at the table with education, with transportation, with corrections, with agriculture. We need to be having conversations about all of those if we really truly want to have an impact on the other 80% of those factors which determine our health and well-being over the course of our lives. So connecting the fields is something that this project has been engaged in. It's a field that's dedicated to using the power of the arts to enhance health and well-being in a lot of diverse contexts. It's comprised of a lot of fields. So there are artists who are certified to do the work they're doing, others who probably never will be, but their work is nonetheless insignificant. It's very important to the overall picture of the available interventions. And we've decided, I put this in there, you all know it, but just to iterate that, the group working on this project has adopted the World Health Organization's definition of health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So I put that there because there's been a lot of process and thinking around definitions in this project. There's a national organization that went defunct for several years and has recently been stood back up, and they've looked to us, because we're at the forefront of this project, to really help them define certain terms like what is an artist, what is health, and other things. So we're working very hard with them on that, and their national conference will be here in September as well. I'm sorry, no, it's in Boston. So to get there and to get the project started, in late 2016, the Rhode Island State Council on the Arts came knocking on the door at the Department of Health. I was the new chief of staff at the time for our new director, Dr. Alexander Scott. We both started on the same day, and the State Council on the Arts said we have in the past worked with the Department of Health on arts and health initiatives, but they were never a priority and they fizzled. Would you put us in front of Dr. Alexander Scott so we can see if we can stand this back up? And she said, sit at the table and run with it, which is what I did. I don't think she thought I'd write a state plan around it. But here we are with a set of policy, practice, and research recommendations that the Department of Health and the State Council on the Arts, along with the help of everybody working in these fields, will try to drive forward to bring this the development of this field to fruition. This is the steering committee that worked on the Arts and Health Advisory Group when we first pulled this team of people together. So the advisory group was made up of about 35 individuals. Everybody from the Philharmonic to Alpert School of Medicine was represented. Dr. Klinger was on a focus group. Many of the people in this room sit on the board. Some of the people in this room. Others of you still can. But Sherry Lynn Brown from the State Council on the Arts and myself act as the co-chairs for the advisory group. We really sat and thought for a long time about what the group would do. We wanted to get at a state plan. And we knew that the state plan was going to set out a set of recommendations, and that those recommendations, if they were going to move the field forward, would need to be based in evidence. So we invited Dr. Stacy Springs to assist us with a research project that was a community engagement project, and Dr. Jay Baruch to sit on our steering committee from the humanities perspective to help us do this work. We met initially, as I said, in the fall of 2016. Will I be able to hit the hyperlink? Okay. And because we wanted to look at the evidence, the first thing we did, the only thing we did for about a year, was bring the artists and the clinicians to the same table and teach the artists how to do research that would help to back up the work that we're doing and to back up the work that they're doing. The result of that year-long process was what we call an evidence map, and it's really just a plotting of the research that we looked at. So the artists looked at 6,100 articles, publications, and culled it down to about 481 that sort of backed up the work that we're doing, and we built this map that lives online at the Department of Health's website. We're currently developing a website for this project itself that will be standalone, so that we don't have to live within the construct of the state website rules and regulations. It needs to be artistic. So on the left, you have a set of ailments such as cardiovascular disease, behavioral and mental health, autism, depression, etc. Across the top is a set of art interventions, and as you drive down into them, I mean, this says dance, but there are various kinds of dance that would be that can be introduced into a treatment plan. So, but the larger the circle, the larger the basis of evidence to back up the work being done. So if I looked at cardiovascular disease and music therapy, you can see the articles, the publications that sort of back that up. This is a tool, so if I click on this, it takes the individual directly to the article, the publication that they would need in order to back up their application, their grant application. It's being updated right now on an annual basis. But we believe it's a pretty state-of-the-art and actually a really useful tool for people who want to move their work forward in this arena. So I just wanted to share that because it's also a first of its kind. All right, back to this. So we wrote the plan. We built the recommendations into the plan, and now we're moving into implementation of those recommendations. So we built a strategic plan around that. And some members of the original advisory group have come together with new members of the team to form what is now the Arts and Health Network in the state. And we have fit the recommendations and the work that we've decided to fit the recommendations and the work that we're going to be doing going forward into 5 sort of focus areas to make sure that we have a focus throughout the work and we're always driving the field forward together in the same way. So those focus areas are patient care, education, community well-being, healing environments, and care for caregivers. And I will go through those in a second. but I wanted to talk a little bit about how we're going to manage through this. We've adopted a network structure because we don't want a big hierarchy. It seemed like at the front of this project, we were RISCA, the State Council on the Arts and Department of Health, sort of driving initiatives forward. We didn't want that hierarchy to be in place. It's not about the Department of Health and it's not about the State Council on the Arts. We want to be, guiding the movement forward in ways that make it relevant and add credibility to it as we build it. So it's less centralized, it's more flexible. I keep doing that. It's here. All right, so we built the network. The Department of Health and the State Council on the Arts are the hub agencies, or what we call the backbone agencies. We're here to lend guidance, like I said. We've developed a steering committee that sort of sits in the middle. It is myself and Sherry representing those two agencies, and a group of individuals who have been involved from the beginning, and some new ones too, to help drive the implementation of the plan forward. I'm not going to stop that unless I put this over here. And the network can look like this. So we currently have lots of partners working on this effort. People come in and out of the network at different places and different times, and it's things like the City Match Maternal and Child Health Conference, which will be held in Providence in September, and we will be teaching holding a roundtable session at that conference around how art and artists can have an impact on trauma and stress that families are going through as members of that family are experiencing illness or sickness. So this is always moving and always growing and always changing. But now I want to dive a little bit deeper into those focus areas. So the first being patient care, which is all about employing the arts within a treatment plan to anticipate and provide for each patient's needs and helping them achieve their goals in consideration of their health condition. So this is really you've heard a lot about this already. It's bringing the patient into the conversation and making them a part of their the decision-making process with respect to their illness and their treatment. The second focus area is education. And this slide is a little off. It ought to include artists because we have programs for educating artists on the clinical processes and programs for educating clinicians as well. And I'll talk about a specific example in a few minutes. Community Wellbeing uses the arts to address public health concerns such as health literacy, health equity, and trauma and resiliency. We already know, because it's been happening throughout time, that the first responders, the clinical teams, and the artists are always the first at the table, the first in the door, whenever a community and individuals impacted that live in that community are impacted by disaster or trauma. They're the ones who set the table for bringing communities back into well-being. So that's what programs that touch on this focus area will speak to. Excuse me. Healing environments is probably the place where most people go when they think of arts and health. It's the art on the walls, the clay tiles with the handprints, the music that's playing over the sound system, but not any less important for sure. And then care for caregivers, which is really my sort of favorite focus area. It's important, isn't it, that we not only take care of the people lying in the bed, but the people standing at the side of it. So how can we build programs around the recommendations that bring this into the plan and drive the field forward? So some examples of what's happening. So this tape art project touches on the three focus areas: patient care, healing environments, and care for caregivers. Michael Townsend is a Providence artist who uses blue painter's tape. And he goes into the hospital setting and he works with families and children to put images up on their walls and so forget about their illness for a little bit of time. Professional development. This is a project that Dr. Jay Baruch and Stacy Springs are heading up. This is very exciting in my mind. It touches on education and care for caregivers. They are taking a group of clinicians, emergency room physicians, who specifically work with patients who've come into the system because of opioid abuse disorder. And they'll be taking those physicians and clinicians to the Rhode Island School of Design Museum with a group of artists to sit and observe art through the artist lens. This will help build empathy, observation skills, communication skills, and really help physicians with that conversation that has to take place that leads the patient into the conversation that helps them determine, a plan of care. Music on the Rounds is a lifespan project. It touches on healing environments, patient care, and care for caregivers. Michael Bresler is a healing musician who works, at the Hasbro Children's Hospital. Music on the Rounds. He has been given, I believe, permission to go into any area in the hospital and use his music to soothe and settle children or patients who are faced with some pretty difficult diagnoses, children with facing bone marrow aspirations and other things. I don't think there's probably too many settings in a hospital where I can't imagine Michael having a positive impact. People have begun, I'm sure, to request his presence in their rooms. And then there's community-centered arts-based recovery, which is a project that is mine, and it's based on things that have been happening over time, like the quilt projects that take place, and the Heart of a Warrior project, which I believe is out of Kentucky, and that project is designed to bring individuals coming back from war back into their community. We're putting a spin on that program and developing it here in Rhode Island for people who are suffering through opioid abuse disorder and associated suicides. It's based on something known as buffalo circles. Is anybody familiar with that? So when a herd of buffalo are being attacked, the young buffalo will stand in one place and the female buffalo will circle them. And then the teenage males will circle the females and the elder males will circle them. It's the elder males who fight the fight, and when the fight is over, those circles are inverted, and the rest of the buffalo will bring the male elders who fought the fight back into the community. They'll be left there to heal and brought back into the community. So we're trying to develop a program that identifies who each individual patient's community is, and then how do we speak to them about what each other is going through. And work as a team, individual teams around each individual to bring them back into their community in ways that are healing. So we have an Artist-in-Residence program, which I'm very excited about. This is going to start in January or August. We put out a call to artists for individuals to apply to work at the Department of Health. They will work with one or two of our programs to help solve a public health question through the artistic lens. So it's going to be the first time, certainly at our department, when an artist has been embedded in a team that is looking at such things as youth suicide prevention, smoking cessation, health equity. Don't know what the program will be yet because we're going to work very hard to make sure that there's a match and that there's an alignment, and it should be very interesting. So this will be a 5-month project. We put $15,000 behind it, and we hope to expand it to a year next year. I should say that I made when I talk about this program, it's always interesting to me that when I put out the call and let the Department of Health staff know that we were going to move in this direction, we were going to bring an artist in to work with them, it was very clear to me that I made the mistake of thinking that public health workers got the connection, right? That arts and health was just a given. And I made that assumption because that's where I was, right? But that was not the case. I've had to do a lot of work with our program people to get them to a place where they understand how an artist can have an impact on driving solutions to the work that they're doing on a daily basis. So it's been very exciting and fun. There are challenges to driving this type of field forward, to the development of this field. There's a lot of strategic planning and partnerships that have to happen locally and nationally. We have to be aligned as a nation on this effort if we want to see things like social prescribing ever happen. In England, you can get a prescription for 3 hours of guitar lessons. We're a long way from that. We've spoken with the medical insurers. We're a long way from this as well, but we want to be sure that if there's a group of artists who are working with a specific intervention, if it is something that they desire to be licensed and certified because it lends credibility to the work they're doing or helps to promote it in some way, that we're speaking to the insurers about that, and that'll be something that takes place over time as well. So with that, I'm finished. I don't know if you have questions or we're going to save time for that at the end or whatever, but I hope you pick up a copy, and if you have interest in becoming involved, you shoot me an email and let me know. Thank you.